Multiple sclerosis national societies and all together in the Multiple Sclerosis International Federation have a fundamental role in obtaining the right answer to the needs of the persons with MS all over the world. It's important the activity of advocacy not only for the access to treatment, the access to health services, but also to have access to all the daily life activities, including work, including leisure, because it is important for a person with MS to have the possibility to live their own life, to have the possibility to be active citizens in their own societies. Research is a fundamental activity of the MS Societies and the International Federation, because all together we can not only fund research, we are collecting the money of all the societies to solve problems like progressive MS, but it's also important the activity that we do in promoting research, in coordinating research, and some of the societies, the biggest ones, have also the possibility to conduct research in-house. That means on themes like public health, health economics, the science of services for persons with MS, to have a fundamental contribution to the research all over the world. It is important our activity in working together all the stakeholders in research, because it is not only researchers, is clinicians, is of course the societies of the persons with MS, but is also industry, is also regulatory agencies. And if they work all together, it is important for having new drugs, for having the proper results, for a good access to therapies, but it's also important for having the decision from the institutions, by the institutions, to have the proper services all over the world for the persons with MS. And when I say services, it's not just hospital, it's all the health service and the social services that are important. And one of them is a problem where research has done a lot, and we can work for access after research, and that is rehabilitation, because at the end, research should have a fundamental answer, a practical change in the lives of the persons with MS all over the world. The MSIF, so our international federation, has an important role in promoting the activities of MS societies, but also an important role in helping all the countries. We have now more than 50 organizations, national organizations that are belonging to MSIF, but we have a work ahead that can be done to promote new MS societies in new countries, because in every part of the world we need someone that is able to advocacy, to fundraise, and especially to be near to people with MS in that country. And this is an important activity where we can help, because for example, twinning or supporting the promotion of new MS societies in new countries is something that every MS society can help for. MSIF, our international federation, has an important role also in international development. Is a task that can help new MS societies in new countries to grow and to being able to offer responses and to the needs of the persons with MS in that country. And this role of MSIF is also a role of MS societies together, that can can organize specific activities for helping new groups, new MS societies to grow and to be able to advocacy and to offer services in their own country. At the conference, we got a clear message. Research is able to offer us the definitive answers soon. And we have another message. We have the possibility, through the activity of our MS societies, to obtain the proper answers to the needs of the persons with MS in all the countries. And there is a message that we can deliver. We often have been listening or reading a sentence that is from bench to bedside, indicating that research should have a concrete result in changing the situation of the persons with MS. But I would prefer to say from bench to real life, because everything we do should have a concrete result on the lives of the persons with MS.